I am your host for today, Dr. Anuradha, and I am happy that we are here with Dr. Abhay Shete. We are here to discuss the important topic that is the vaginal stage, its infection, care, and prevention. Today, before we begin, I want to give our audience a general insight into BabyChakra app, what it is, and what the platform is all about. BabyChakra is the India's largest pregnancy and parenting platform. It is a one-stop destination for pregnant women and expecting parents. We try to connect with the parents and experts who bring their valuable information and research-based information to all of the audience. On that note, I will like to kickstart our today's topic with what we are going to discuss over here. We are going to discuss about the vaginal stage, its infection, care, and prevention. And today we are here with our amazing speaker, Dr. Abhay Shetty. Sir, please introduce yourself.
Well, I am a practicing obstetrician and a gynecologist. I've been practicing since the past 40 years almost. Situated in Panvel. I have my own setup. I was also working for ESIS hospital and major hospitals. So I've seen many cases, and I should be able to help you with the questions.
Thank you, sir. Thank you for joining us today and sparing your valuable time for us for answering our question. Let me introduce the audience, the topic once again. We are here to discuss the vaginal stage, its importance, the care to be taken, and any kind of infection related to it. So, along with that, I also want to introduce myself. I am Dr. Anuradha. I am a homeopath by profession and a prenatal yoga therapist. I am mother of two kids. My younger one is just 3 month old, and the elder one is 7 year old. So, with the experience of two kids and with the experience of two deliveries, I have many questions in my mind. I want to ask you regarding it. So, sir, the first question will be how to take care of the stage after delivery to minimize the risk of pain and infection in it.
Good question. But actually, if you ask me, uh, the preparation for the healing of the wound does not begin after the wound has been created or stitches have been taken. It is before that. So antenatally, I would say the patient should be prepared physically, mentally, and spiritually. Now I'll explain each. Physically, you have to be good health, you have to eat well, you have to have good diet, you have to have good, I will say, blood supply there. Always blood supply is there. But now, since you are a yoga therapist yourself, you will understand that if exercises are done, if perineal exercises are done, then obviously the blood flow is good and the healing will be good. So antenatally, what I would like my patients to be in good hygiene. Okay, so they must eat well. They must see that the bowel habits are good. They must see that their all the precautions that they take are well hygienic. They are doing exercises, and not only for the delivery but in general as well. So this is the care that is to be taken antenatally. During delivery, well, they have to be well hydrated. They have to see that they don't go in dehydration. They go through positive phases, and mentally also they are prepared that there will be a small nick that will be taken for the baby to deliver. That's called episiotomy. And after episiotomy is taken, the episiotomy is sutured. In good old days, they used to suture with catgut, but now better material is available. So most of the obstetricians will now take a rapid vicryl. So it's a very soft stitch. It doesn't pain and it heals very faster and it stays for long. No, it doesn't stay for that long. Okay. So what do you do the next? After the stitches have been taken, antenatally you are prepared, mentally you are prepared, physically you are prepared. Then you have the stitches have been taken. Now comes the next part. Next part is taking perineal care. So perineal care, how do we take? Nothing big. All you have to do is to see that it is clean. Every time you pass urine, stools, you have to wash them. Then next you have to apply ointments. If possible, take sheets bath and see that the wound is clean. Any pain, any discharge, report immediately. By the time you are in the hospital, doctors will see to it that they will be caring for it, they'll be having a look at the stitches. But after you go home, you have to take care, and if there is any problem, you have to report back. Else, till the time, you have to take hot fermentation, take tablets which are prescribed properly, and it will heal on its own well if you are mentally well prepared, physically well prepared, and spiritually prepared as well.
Okay, thank you, sir. It is very necessary to exercise during pregnancy. What I had seen in my experience, if you exercise well, you are your healing is very proper and very fast. Sir, on the same point, like how much time it will take for the vaginal stitch to heal?
Yeah. See, the normal healing process is about 6 months. Okay, don't get scared. 6 months is the time it comes completely to normal. But the major healing process takes place by 6 weeks and by 15 days to 6 weeks. So what happens in this time is the epithelium that first gets healed, then the muscularis get healed. So every tissue starts healing itself, and the healing process gets about 15 days is the time you must take, because that is the time we expect the sutures also to fall off. The sutures are absorbable sutures, they are not non-absorbable, so they are going to fall off on their own, and that's the 15 days is the time we expect that the stitches will heal on their own.
Okay, sir. So at the time of stitch, we had given that anesthesia around that area. So after that, if the pain still persists, like the pain will start once the anesthesia is gone. So what we should do regarding that pain?
First thing we must understand, that is why I mentioned that spiritual preparation and mental preparation. Okay, that physical preparation, yes, we are giving you painkillers, we are going to give you painkillers. That is going to work. But basically, there is a mental block that if there is some stitch there, it has to pain. It's not so. If I'm mentally prepared, that there is going to be a stitch, I'm mentally prepared that my pain is not the pain, but I have to raise the threshold of my pain. Okay. Unfortunately, what I see nowadays is the women or even the men have a very low pain threshold. So even small discomfort also they are not able to bear. In fact, it's not. It's I will say the outer part of the stitch. That's the epithelium, or the that part is very sensitive. But the inner part is not as sensitive, and it is not as painful. So if there is pain, unless there is a hematoma, unless there is infection, there may not much of a pain. The body goes into its healing phase. What has been done is the stitches have been approximated, and they have been just tied and kept together. They are going to heal. There will be some amount of pain, yes. Lignocaine ointment will be given to you, so painkiller is given to you, and it should be suffice. If you're going to take seeds bath, as I said, you have to sit in warm water, and if you're going to do perineal exercises, which will be taught to you when you are antenatally, you will be explaining to them about the perineal exercises. Obviously, the perineum is in a good state, and it will heal on its own. So I request all the those who are listening, don't be worried about the pain. Be mentally prepared. Enjoy the happiness that the baby is there, and that will all take away your pain.
Yes, sir. Once the baby is out, all pain is gone. Once the mother sees the baby, she will forget about the pain. But still, the fear is there. That fear causes the pain, and that fear causes the problem.
Yeah, so
Sir,
that is the reason why antenatally getting prepared. Okay, that is
yes,
very
sir.
very important. That mentally, I am once I know the fear of unknown is gone. Many
Hmm.
times is the fear of the unknown. दर्द कैसे होगा, मुझे क्या होगा, वहां पे टाका लेंगे तो वो जगह पे तो बहुत दर्द होगा. Not really. That place is no different from any other place in the body. Okay, it is richly innervated. Yes, it is innervated, but the healing process is the same. So you need not have to worry, and just be with it. Be with the counselor. Talk to them out. Talk to your doctors, and they will help you relieve the pain.
Yes, sir. So all we need is mental preparation, basically. Yes, sir. Thank you, sir. Next question will be like, do we have any problem, or do we get any problem related to that stage in future?
Related to the stitches, yes and no. Okay,
Acha.
so as I said, there are many ducts which are connecting from the rectum to the vagina. They sometimes get cut. I have had patients after so many years of practice. I have seen that sometimes this duct gets clogged, and there is a problem which we have to resolve it later on. But by and large, 99.9% of them heal well. But if there has been a deep cut, if the cut has gone and involved the rectum, yes, we have to take more care. We have to take more treatment, And also it depends on the healing power. So that's what I'm stressing all the time, that your healing power should be good, because if healing is good, even if there is a cut to the rectum, it heals well, because that part is very richly, I will say, innervated as well as supplied with blood supply. So healing is good, healing power is good. Our women are young,
Yes,
they are
sir.
not suffering from any diseases, so healing will be good. So they will cause no problem in future.
Yes, sir. Sir, is there any specific diet related to it? Like, is there any specific things to be avoided to get heal early?
Yeah, there's nothing that you should avoid. What I tell my patients is eat what you have been eating, but eat a high protein diet. That is very good, because you need proteins for healing. Okay, so those who are non-vegetarian can have a non-vegetarian diet. Those who are vegetarian should have pulses, dal, and good amount of proteins which are present in vegetarian diets. Those who are vegan can also have vegan diets, which are good source of proteins. That they also have that. So whatever diet you're used to, please eat well. What happens is, what I have seen in many of the Indian communities and Indian houses, is they are forbidden from eating something. डिलीवरी हो गया, अभी ये नहीं खाने का, वो नहीं खाने का, इससे ये होएगा, उससे वो, nothing happens. That is all wrong. You must eat well, because you need proteins. And more importantly, taking care of the stitches. So what a woman can do, eat well and take care of the stitches, apply ointments, see the part is clean, take seeds bath. Okay, use disposable pads. I've had patients who do not use clean diaper, clean pads. They use some old cloth or something. Should not be avoided. They are kept, aloof. No, they must be well within our family. They must be mentally supported, and everyone must be there around her to support her. She must be feeling, she feels low, so she must be brought out, and she must be said all is fine and all will happen. And mothers can do this. The family members can help her to, recover faster and come back normal, so that postpartum depression, there is one more thing that comes up, is avoided at our cost, because that will again impair healing. So healing is a part and parcel of the whole. It is not a simple tissue joint and it heals. No, the mind has to be good, the body has to be good, the spiritual aspect has to be good, and there has to be good bonding between the family members and the new member that has come in. Only then it all works.
Yes, sir. Thank you, sir. Sir, there is also fear that I will not be able to sit after that stage. So, is it true or it's a myth just?
It's a misconception. As I said, it is more because of the fear that there is something wrong there. I've had patients who had major surgeries not related to vagina but to anus and vagina and every repairs, and they were able to sit and they were able to do everything well. They're able to walk. Everything is, as I said, that part is no different. So all it matters is taking care, getting mentally prepared, and enjoying the process. Well, I'm a male. You may say, how do you call it enjoying, sir? You do not go through this. People tell me that way. I say I may not be on that side of the table, but from this side, I must have thousands of deliveries I must have gone through, and I can tell you the joy that I experience every time. Okay, is much more than whatever the pain or whatever the woman feels. She is least bothered. She just asks, "How's my baby?" She wants to hold the baby, and she wants to, be with the baby. That's it. And that pleasure is, the hormones that are secreted in the brain that takes care of all the pain. The pain vanishes. Endorphins are endogenous opiate peptides. These get released, and once these are released, there is no pain. So do not worry about pain. Enjoy the process. Be with the process. Don't be scared. Fear is the main problem. Don't get scared. No, be aware. Watch videos. Talk and get learn. And once you're wise, you will never feel pain.
Thank you, sir. Thank you for such wonderful insight.
Fine. If there is anything else, fine. Otherwise, I think we have covered this topic. We have told them that main important aspect is mental, physical, and spiritual as well. Because being a mother is something which is something which I cannot, as a man, experience. But being with women for so this pregnant women and the women delivered for so long, sometimes when she delivers, even I get the joy and happiness. Even my body starts secreting endorphins, so I can experience this also. So the father, I insist that father also must be present in the labor room, or must support the wife and must be there, so that the wife and the whole unit enjoys and experiences happiness.
Yes, sir. Yes, sir. That will be a takeaway message from our session, that you should be mentally, spiritually, and physically prepared for the delivery, prepared for the stage, prepared for the pain. You should not get fear about what is the pain, and you should be on the other side. Like, you should feel about, you should start feeling about your baby, the joy, the happiness. Then everything will be taken care.
Absolutely, absolutely. You
Yes,
said
sir.
it right. What you said was being on the other side. What I understand is being positive. Rather than
Yes, sir.
focusing more on the pain, focus more on the enjoyment, on the new baby coming in.
Yes, sir. That will be our takeaway message from our session. So I am
Yes.
thanking you today for joining us with Baby Chakra and giving us such a valuable information regarding the very sensitive topic, that is vaginal stitch, its care, its prevention, and everything related to it. So,
Yes. I also thank
ending
Baby
up on
Chakra.
this session.
Yes. I thank Baby Chakra for bringing out this topic and making it, available to the people, so that they get over these fears.
Yes, sir. Thank you, sir.
Thank you.